Effect of stress on body and general health. Stress in life is very common due to emotional ups and downs in life. Stress occurs from our environment, from our bodies, or our own thoughts and how we view the world around us. It is very natural to feel stressed around moments of pressure. Human body is physiologically designed to deal with stress, and react to it. Under pressure, the nervous system instructs the brain to release stress hormones including adrenaline, noradrenaline and cortisol. These hormones produce physiological changes that protect the body from the threat or danger of the stress. This is called the stress response or the fight or flight response. Stress can be in a way helpful, as the stress response makes the person stay alert, motivate and focus on the task at hand. Usually, when the pressure subsides, the body rebalances and the person feels calm again. But stress too often or for too long is not advisable. When the negative feelings overwhelm the ability to cope, then problems will arise. Continuous activation of the nervous system, due to the stress response, causes wear and tear of the body. The respiratory system is affected immediately. Victims start to breathe harder and more quickly in an effort to quickly pump oxygen-rich blood into the body. Although this is not an issue in normal case, it can be a problem for people with asthma. They feel short of breath and struggle to take in enough oxygen. It can also cause quick and shallow breathing, where minimal air is taken in, which can lead to hyperventilation. This is more likely when someone is prone to anxiety and panic attacks. Then stress wreaks the immune systems. Cortisol released into the body suppresses the immune system and inflammatory pathways, and the person becomes more susceptible to infections and chronic inflammatory conditions. The ability to fight off illness is reduced. The musculoskeletal system is also affected. The muscles tense up, a natural way of protecting the body from injury and pain. Repeated muscle tension can cause bodily aches and pains. When it occurs in the shoulders, neck and head, it may result in tension headaches and migraines. There are cardiovascular effects also. During acute stress, heart rate and blood pressure increase, but they return to normal once the acute stress has passed. If acute stress is repeatedly experienced, or if stress becomes chronic, it can cause damage to blood vessels and arteries. This increases the risk for hypertension, heart attack or stroke. The endocrine system and metabolism are affected. Endocrine system plays an important role in regulating mood, growth and development, tissue function, metabolism and reproductive processes. The hypothalamus in the brain plays a key role in connecting the endocrine system with the nervous system. Stress signals coming from the hypothalamus trigger the release of stress hormones cortisol and epinephrine, and then blood sugar is produced by the liver to provide enough energy to deal with the stressful situation. Most people reabsorb the extra blood sugar when the stress subsides, but for some people there is an increased risk of diabetes. Stress can have some unpleasant gastrointestinal effects. We might experience heartburn and acid reflux, especially if we have changed our eating habits to eat more or less, or increased our consumption of fatty and sugary foods. The ability of our intestines to absorb nutrients from our food may be reduced. We may experience stomach pain, bloating and nausea, diarrhea or constipation. There can be problems with our reproductive systems too. For men, chronic stress may affect the production of testosterone and sperm. It may even lead to erectile dysfunction or impotence. Women can experience changes to their menstrual cycles and increased premenstrual symptoms. Stress has marked effects on emotional well-being. It is normal to experience high and low moods in our daily lives, but when we are stressed we may feel more tired, have mood swings or feel more irritable than usual. Stress causes hyperarousal, which means we may have difficulty falling or staying asleep and experience restless nights. This impairs concentration, attention, learning and memory, all of which are particularly important around exam time. Researchers have linked poor sleep to chronic health problems, depression and even obesity. The way that we cope with stress has an additional, indirect effect on our health. Under pressure, People may adopt more harmful habits such as smoking, drinking too much alcohol or taking drugs to relieve stress. But these behaviors are inappropriate ways to adapt and only lead to more health problems and risks to our personal safety and well-being. So, learn to manage your stress before it manages you. ETRTM is all about keeping it in check. Some stress in life is normal, and a little stress can help us to feel alert, motivated, focused, energetic and even excited. Take positive actions to channel this energy effectively, and you may find yourself performing better, achieving more and feeling good. Wishing all a stress-free life. Thank you.